HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Having a compassionate doctor help with pain is great. Having two doctors is even better. Join us with brothers Michael and Frank Schirripa in their brand new pain management offices located on the South Shore of Staten Island. Give it a listen.
Hey Staten Island, welcome to HealthWish. I'm here at 101 Terrellin Avenue in the beautiful South Shore of Staten Island. I'm sitting here with two amazing physicians.
I'm Frank Schirripa. And I'm Michael Schirripa.
And you two gentlemen, I think, have known each other for a while.
Yeah. We're fraternal twins. He's actually 22 minutes older than me. So we've been around each other 33 years now.
And I think it's really cool to note that these two physicians not only are from Staten Island, but actually grew up in a physician family. Tell us who your dad is.
My dad's Michael Schirripa. He's OBGYN. He's been in practice for over 30 years. It made us very proud.
Your dad was one of the busiest OBGYNs on Staten Island for a very long time. Still in practice. Clearly you had a positive predilection towards medicine growing up. And for a while you actually had common paths, right? You did a lot of stuff together. Tell me about that.
Yeah, so we did everything together. I mean, high school, then college together. We played every sport together. We had similar grades. And, you know, in college, we studied the same thing. We had the same majors, same minors. Although even my father, he didn't necessarily push us toward medicine, but we just had, I guess, a drive to go that route. And we ended up scoring well on our MCAT and standardized exams and got into the same medical school, Virginia Tech. And we knew right away when we both were accepted that we had to go together. And it was great because it's a good support system. We leaned on each other. We studied together. Yeah, so we did everything up until the point of residency. And
then your paths finally diverged.
Exactly. I did anesthesia. I went the anesthesia route.
I was very interested in pain management because with rehab medicine, you would rotate through pain management sites. And I was so interested, I was telling Michael about it. He didn't really want to hear it from me at that time.
That's true.
So I said, Mike, check out this field. He reluctantly accepted, but it opened his eyes to the field. It has a nice balance of pain management. I mean, you have outpatient, you have procedures, you help a lot of people. And so that's what really enticed him, but I knew earlier. That was exciting.
Yeah, that's true. Without Frank pestering me, back and forth. No, he definitely invited me in to do some research and was encouraging me to explore the field of pain management. And when I did, we ended up publishing papers together, and then thank God for Frank, because otherwise I wouldn't be here.
How many people a week are you actually taking care of in this room?
We're seeing at least 200 patients a week each. In this operating room suite, probably up to 60 to 70 patients.
So several thousand Staten Islanders a year are going to be helped out of this space. And we're going to talk about what you both do in a second, but if you think about it, from an idea that you first had and then got you on board, to coming back to where you grew up and being able to help people in your community with real pain issues, that's got to be a special thing.
This is very sentimental to take care of our community because they took care of us.
We treat patients like their family. There's just a visceral kind of reaction when you're treating your own, and it's a dream come true. It's been great. So,
and Staten Island has 500,000 people on it, and yet most of the people know that it's this giant small town. You run into people that you know all the time. It's one of the special things about being in this place. And when you have an opportunity to actually give back and practice there, and develop a career and make a good living, and do it in a place that helped form you, right? So pain management means so many things to so many people. And frankly, when you talk to people about pain management, there's a lot of misperceptions about what it actually is. On the one side, it's a field that really has developed over the last really couple of decades. Like it really just didn't exist before. And yet, I hear misperceptions about pain management all the time on both sides. On the one hand, I hear, oh, that's where you go to get pills. And then on the other side, I hear from people, well, why would I do that? I'm going to end up in surgery anyway. Dispel that misperception and kind of tell me what you really do.
I think the most important thing is board-certified pain management doctors, this day and age, we have a lot of tools. The most important thing is listening to the patient because there's many different types of pain and there's different injections, there's different therapies, there's certain like nerve medicines or even simple anti-inflammatories can make a world of a difference. And we're really implementing a lot of that. And we do see sustained long-term relief, including all those things, physical therapy, chiropractics, injections, different safe medicines, non-narcotic medications. Most times we're getting people that type of relief. In some cases like cancer pain, sometimes they need a little help, but we really try not to initiate this narcotic type regimen because it's more of a Band-Aid. We're really trying to see long-term relief, even without medications in general. When people are really not getting better with this type of treatment plan, we do work closely with surgeons, orthopedics, neurosurgery. I would say 70–80% of the time, people will get long-term relief with the treatment that we provide.
Yeah, and we've had success. I mean, it's not just a thought. I mean, we practice this way and patients are doing very well. But for the most part, I mean, when we see a patient with a new pain or a new injury, we get them better and we restore their functional status through multimodal approach, through physical therapy, conservative management, home exercises, anti-inflammatory medicines, pain medicines like Frank said. And ultimately, it's about making the proper diagnosis. The complaint of pain is very, very broad, very complex. And people might say, I have pain here, but you have to identify the exact pain generator. And making the diagnosis properly is really how we pride ourselves. When you have that made, we have specific and dedicated treatment plans for that diagnosis. We use precise image-guided injections and therapies, and interventional therapies that are very safe and simple.
If 5 people walk in here for a new episode of pain, 4 of them probably aren't going to need surgery and will get significant relief from what you're trying to do.
Correct, yeah.
The fact that you can go through and actually get improvement on your pain without having to necessarily need that 4 to 5 times, that's a big deal for people.
Yeah.
Join us next time as we continue the conversation. HealthWish wishes to thank our special guests, Dr. Brahim Ardolik, Dr. Michael Schirripa, and Dr. Frank Schirripa. Recorded at 101 Tyrellin Avenue, Staten Island. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.